Hello, everyone, and thank you for joining us for this edition of Talkin Kids Health. I'm Beatriz Canals, and we're coming to you live once again at Nicholas Children's Hospital.
Hello, everyone, and thank you for this edition
Dr.
of
Toba
Talkin Kids.
Niazi, he's a pediatric neurosurgeon, she is rather, and Dr. Ziad Khatib, who is the pediatric oncologist here at Nicholas Children's Hospital. Thank you so much. I know how busy you are, so we really thank you for being with us here today.
Thank you.
Specifically, both of you are working with children who have been diagnosed with brain tumors. Dr. Khatib, it was shocking for me to hear that the second leading cause of cancer in children are brain tumors. Devastating when you first hear that. Talk to me about these statistics.
Yes, Beatrice, thank you so much for coming. Brain tumors are the most common solid tumor in children and the second cancer after leukemia, but they're still rare. Pediatric cancer is not that common. Approximately 1 in 100,000 children may get a brain tumor, so it's relatively uncommon. But in the US, that's almost 3,000 children every year, and the incidence has been steady. There may be a slight increase over the last decades, but that may be because our MRI scanning is we have better technology, so we're seeing more. But overall, it's relatively constant. Most of these cancers are sporadic by chance. They're not related to families or environment or diet in children. But there's a certain percentage, 10 to 15%, that may be genetically related. So the success rate, however, is excellent. The majority of children with brain tumors do well, but we still fall behind because most of the children who die from cancer are dying from brain tumors still. So we have ways to go on our research and successes.
And so much of it is being done here, and you really do have the most innovative in technology to be able to help patients. To talk about this special program, it is dedicated, Dr. Niazi, to identifying, treating, and really the lifelong management of the condition here at Nicholas Children's Hospital. Tell me more about what I found fascinating, which is that it really is a team effort to actually cater to each patient.
Absolutely.
How does that work?
Absolutely. Well, we are really on the front lines. The patient first gets diagnosed with a brain tumor, and we're the first ones that get called about those kiddos. But then really it becomes a diagnosis component where we help to diagnose, help to treat any acute problems that occur. And then we really pass the baton over to our oncology colleagues, our genetics colleagues, if they need to be involved, our pathology colleagues. So it's really a multidisciplinary approach to make sure that we're doing the best for these kids and giving them the accurate diagnosis and appropriate treatment, as well as not just treatment and medical care, but also really the social aspects surrounding the entire diagnosis.
So throughout this, all of you truly remain involved.
Absolutely.
In the treatment of the child.
Absolutely.
And what is best for the patient. Dr. Khatib, when we talk about the treatments, for parents who perhaps recently were given that diagnosis for their child, it has to be very scary. And I imagine their first reaction must be, what can I do? What is out there? How can my child be helped? What are the treatments here at Nicholas Children's Hospital that are available to them?
So when we're evaluating a child with a brain tumor, as Dr. Niazi mentioned, our multidisciplinary team helps the family. It's the doctors, the nurses, we have nurse practitioners, child life specialists, social workers. The whole team is here to help the family cope with the treatment and start the treatment. We're fortunate to have the best surgeons in the nation, so we have the first step is to remove as much of the tumor, if not the whole tumor, as possible. And then after that, based on the type of tumor, if it's low-grade, malignant, there are probably 50 different types of brain tumors. Each tumor may require more therapy or no therapy. So first it's the surgery, then we may have to give chemotherapy, and here we participate in the latest treatments for brain tumor chemotherapy, including stem cell transplantation. We're fortunate to have a collaboration with the first proton beam radiation center that's designed to give the safest radiation for young children, preserving their brain function, hormonal functions. So that's something that we're the only center in South Florida that has. So it's a combination of surgery, chemotherapy, and radiation therapy at times.
That's wonderful, because so often when you hear these diagnoses, one of the concerns I know that you hear parents say is there is that fear that if they need radiation, could that do more harm than good? And you mentioned that you were able now to offer at least the least damage possible in other aspects, and just treat the condition. When you mention having some of the best specialists, if not the best, there is reason to feel proud of this program, and the reason is that the pediatric neurosurgery program here is now ranked 11th in the entire nation, and this is according to U.S. News and World Report's Best Children's Hospital rankings. Not only that, but the program is really in the Southeast. It ranks higher than any other program in the Southeast, so that's impressive. What are the surgical interventions and the outlook after surgery, Dr. Niazi?
Sure, I think we're very fortunate here. So all three of us here, Dr. John Raga, Dr. Sanjeev Bhatia, and myself, I think the really truly unique aspect here is we work as a team. And so what our goals are really is for the best for the patient, the best outcomes after surgery, and the lowest neurological deficit rate after surgery. So we want to bring kids out just as good, if not better, after surgery. And that's really our goal, and then to help them move forward. We really have all of the tools, all of the new tools available to us. So we have an intraoperative MRI here that we use quite frequently, and for every patient with a brain tumor, we do use it. It is a good, useful adjunct to what we were doing before, but it also, what it does is it limits having to put these children under another general anesthetic after surgery the next day, for example, post-op, to see the extent of the resection.
I'm sorry, so this means, just so that we understand, during surgery, right after surgery, you're able right away, because you have that MRI.
Absolutely.
In the surgical, in the operating room, you're able to see.
Yes.
Absolutely.
That's wonderful.
So if there's residual tumor, we can go after the residual tumor, or we just get the post-op MRI under the same anesthetic. Other aids for us that we use is we have minimally invasive options as well as the open options. So we have the endoscopic procedures where we put a camera into the fluid space of the brain and help us to take the tumor out. We have lasers, and then also MR-focused ultrasound. So we have a lot of different tools that we can use, and we use what's best for each patient, and we tailor their therapy as such.
That's what makes the program truly so special. We're so fortunate to have it here in our own backyard. When you talk about being able to give them this treatment, what is, I know you mentioned it briefly, but it's important to offer hope to parents who have heard this diagnosis recently. What is the prognosis after treatment?
So the prognosis depends on the type of tumor. As I mentioned, there are tumors that have 90 to 100% success rate just with surgery. And those are fortunately the most common, the astrocytomas, and patients do very well. There are some types of tumors that are a little bit more malignant, and they have an average of 70% cure rate with chemo and radiation. And there's a subtype of very difficult tumors that have like the malignant gliomas, glioblastomas, and those are the ones that we have to do more work. We need more research, and we're still not there yet.
Is there an advantage, doctors, to early detection?
I think absolutely, but I think the one thing that we need to tell parents is that, and I get this question oftentimes, what could we have done differently? Children, when they get sick, and that's the last thing that's on your mind that you think about with your daughter or son, that something is going on in their brain. So I don't think that we've lost any time once they've got here, in the sense that when children are sick, they come to attention and we're able to take care of them. It's very different than early detection and screening that we see in adult patients, I guess is what I'm trying to say. There's a very different component. We can't correlate childhood brain tumors with that of adults and early detection and prophylactic management. It's a very different disease process.
And what's more important than early detection is going to the right place early. So
Absolutely.
Make sure if somebody has a brain tumor, make sure it's Nicholas Children's Hospital.
Absolutely, that's why we're here today. And so as experts, you give us this incredible wealth of information. As parents, what message do you have for parents out there that are facing this?
I think that the one thing I'd like to tell every parent is that we'll get you through this. It's going to be a marathon and not a sprint, but we'll get you through it, and we have treatments for everything.
And our team not only helps the child, but we help the family, the parents, we help them through the process, whether it's winning or in some cases losing, but we're here to help them have the most smooth and comfortable journey for this cancer.
And you see so often in having the privilege of working together to bring awareness for Nicholas Children's Hospital, the team that you talk about, I've witnessed it, and it really does make such a difference. And the fact that you do see it often as lifelong treatment that we mentioned, which is you will be with the family every step of the way throughout their journey, which I think is wonderful. For everyone out there, it's important to keep these programs going, and you can actually play a role in this by supporting them so that we can continue to have the specialists that are truly the best here in our own backyard and the latest technology. There are many ways that you can support. What do you think is the best way that parents out there that want to support and keep these programs going, what can they do to help?
So you're going to talk about the walk.
The walk and
So-
going online to Miami
so
Children's
you
Health
go to-
Foundation.
MCHF, Miami Children's Health Foundation. Press on the button donate and make sure you mention donation for brain tumor research. So we do have funds that support new research for brain tumors. We're here one of the centers that does a lot of basic science research, clinical trials, and we have the latest protocols for brain tumors. So please support brain tumor research at the Miami Children's Health Foundation.
Truly important because, as you mentioned, while you are doing some amazing work here, there are some aspects that just are unknown as of now. So if you have more research, then you can better help parents out there that may find themselves in this position. And if, God willing, you don't ever find yourself there, you'll know that you have actually helped parents who did. And as parents, we're so grateful when our children are healthy, right? It's a good reason to help others who are facing these challenges. Another great way to help is to strap on or put on your sneakers and head out there, lace them up, and that is for the 5K walk. I know you'll be there. We'll all be there. I'm also very honored. I've participated and emceed for a few years. I'll be out there again. And each of you have your own teams going, your programs
Absolutely.
too.
Absolutely.
So,
Yes, join us October 28th. Team Mission for Remission.
And Team Brain Tumornators.
there you have it. And you know what? They've got a little competition going here. I
We sure
understand.
do.
To see who gets to the finish line first. So if you want to join in, October 28th, as the doctor mentioned, and that's because the date was changed. They actually gave us a little more time to get in shape and get out there. It was postponed, unfortunately, because of Hurricane Irma. But the good news is now you have a chance to join if you haven't. So go on to www.mchf, that's Miami Children's Health Foundation, and you can log on .org. So www.mchf.org, and you can join a team, create your own team if you can get your friends to rally around you, or just come out and join us. It really is a wonderful event in Coral Gables. So hopefully you'll join us and we can have all of you out there on that wonderful day, October 28th. Don't forget. Doctors, thank you so much for joining me. I know how busy your schedules are and you're doing some great work out there, so glad we could steal you away for a little while. I hope you join us again. All of you, thank you for joining us as well. Right here as we're talking Kids Health. I'm Beatriz Canals. Be sure to keep your kids healthy and always happy. Take care.
Thank you.
Thank you.
Thank you, doctors.
Thank
Wonderful.
you.
Take care.
It's wonderful.
So,
Thank you.
oh,